Dear viewer, I am Rocco Barazzoni, and as ESPEN chairman, it is my great pleasure and honor to introduce the ESPEN 2022 Malnutrition Awareness Week, a new ESPEN initiative aimed at healthcare professionals, policymakers, and we hope the public at large to increase awareness on the huge challenge of disease-related malnutrition. As food is a fundamental human right sustaining life, we believe that it should be defended and granted when we need it more. That is, when we are sick and cannot preserve our nutritional health through regular diet. That is when nutritional care is a medical treatment, a life and health supporting measure, and indeed a human right of its own.
On September 5th, 2022, the fourth major international clinical nutrition societies, ESPEN, ASPEN, FELAMPE, and PENSA, in conjunction with representatives of patient associations, dietitians, IFAD, and a global network of 75 national societies, met at the 44th ESPEN Congress in Vienna to sign the International Declaration. The International Declaration on the Human Right to Nutritional Care is a global call to policymakers, medical associations, and civil society organizations for urgent action against disease-related malnutrition. The aim is to promote the recognition of the human right to nutritional care, intrinsically linked to the right to food and the right to health.
Nutritional care works to reduce complications, improve quality of life, save lives, and reduce healthcare costs. We have stronger and stronger evidence for that, and ESPEN will commit to implement nutritional care through our long-standing actions and missions in promoting best science, education, clinical nutrition practice, together with a new action plan that we will launch during the Malnutrition Awareness Week.
As part of Malnutrition Awareness Week, ESPEN is proud to launch an action plan to translate the 5 principles of the Vienna Declaration into consistent actions to promote access to nutritional care for all patients with or at risk of disease-related malnutrition. The first principle outlines that clinical nutrition must be integrated into public health policy based on human rights. ESPEN will launch a policy brief summarizing the burden of disease-related malnutrition and the importance of nutritional care implementation in healthcare policy. The second principle refers to the importance of clinical nutrition education and the value of research. ESPEN will work on new educational material to facilitate the implementation of the Nutrition Education in Medical Schools NEMS project, and besides, ESPEN will support and disseminate research activities on nutritional care.
The third principle of the Vienna Declaration addresses ethical principles and values in clinical nutrition. ESPEN's action plan includes an update and expansion of our ethical guidelines for healthcare professionals. These new guidelines will include all recent updates in human rights, such as the FRIDA principles: fairness, respect, equality, dignity, and autonomy. The fourth principle of the Vienna Declaration calls for an interdisciplinary approach in clinical nutrition. ESPEN will continue promoting awareness of disease-related malnutrition among all healthcare professionals in all countries. Along all our educational activities, this includes the world-famous Nutrition Day survey, as well as the current lobbying of WHO to update the international classification of diseases, such as the definition of malnutrition matches the GLIM definition. The fifth principle of the Vienna Declaration promotes patient empowerment. Patient empowerment is a very powerful step and a tool to improve healthcare. There are patient charters in many fields. ESPEN will promote inclusion of nutritional care in the existing and new charters by collaborating with the associations representing the patients and their families. We will help promote the dissemination of these charters with many stakeholders, including the policymakers.
Strong healthcare demands strong nutritional care for every person in need. Together we are stronger, and we hope you will join ESPEN in promoting awareness on disease-related malnutrition and nutritional care for all. Thank you very much.